So we are one day out from an FUE procedure. This is a gentleman that's had an FUE. We had one before or two?
Just one.
Just one before. And he's a day out, and I'm just going to show you the harvest site. What I did was I really blended around the zones that he's had prior harvesting in areas of greater strength. I've taken beard hairs as well from the bottom here. You can see that. Essentially, so how I planned this was he was bothered by his part on the left. So I used a very fine 1-2 hair grafts from the scalp for that area. I used only scalp hairs for this central zone because you want to have not only density, but you want to have naturalness. So the back side where his posterior mid scalp, you can almost see it's very open and then becomes less open down here. So the upper half, I was able to harvest 3-4 hair grafts to create strength up on this top zone. And the bottom part, I used the beard hairs to blend really effectively. I actually was able to pull difollicular grafts, in other words, 2 hair grafts from the beard, which is not that common. So I'm super excited about that. Could you tell us a little about the experience difference from what you had in Austin compared to what you had with us?
Yeah, it was completely different from beginning to end. It felt more professional for sure. And then secondly, the recovery wasn't any. Once it's over, I was able to get up, no problem, leave, and go about the rest of my day. Actually, last time I had to go right to sleep. I was so out of it. And then waking up, I was getting ready to take my prednisone, and I'm starting to think I don't even need it. I don't have any swelling, pain,
of course not.
or anything. So I feel good to go. Sometimes I need to remember to keep my hands off my head because I did have a procedure done. So I couldn't be happier.
So the experience at the other place, the day of, what was the difference between that versus what you experienced with us?
I don't even remember going home the day of. I remember my wife picked me up. I don't remember getting in the car. And then I went to sleep, and I slept until the next day because I was so out of it. And then in the morning, I was like, from the middle of my forehead here up was like a balloon. That's why I had to start taking the prednisone. And then at night I was taking certain pain medication because where they took it from the back was really achy. Yeah. I didn't take any pain medication last night or this morning, and I might not even use the prednisone, honestly.
So the reason why there's so little discomfort, in fact, I've never in all the years of doing FUE ever had any pain whatsoever, not even a 1 out of 10. Part of me is that I use a lot of what's called tumescence. So tumescence is fluid that pulls the harvest site from the neurovascular bundle below it, so there's no nerve irritation. In fact, I've got a guy I'm going to do probably today, the weather is bad, but next week, who's got permanent nerve damage from FUE he did in Turkey. He's actually had numbness. He has pain and numbness. I'm going to be fixing that with his unique technique, which I can fix, by the way, that I'm publishing. But I hope I can fix it. But the other thing, so I use tumescence that pulls the site of harvest away from the neurovascular bundle. That's why there's very little discomfort. And the other thing, which is just experience. So when you were harvesting so I do all my own harvest. When the punch goes through the dermis, when you feel a little bit of a release, you're right at the base of the follicle. So the nerves are farther down. If you're inexperienced and you don't know how to have that feel, your punch will go too deep. So if you don't have the cushion of safety, which is really the tumescent fluid, plus the gentle technique of knowing exactly the depth, because if you go too deep, you transect. Right. And if you go too deep, you're going to cause neurovascular irritation. So this is the reason why he has zero discomfort. And in 20 years, well, I haven't done FUE for 20 years, but I've done FUE for 10 years. And I will tell you that with FUE for the last decade, I've just had not even one incident of any discomfort whatsoever. But I've managed FUE pain and FUT pain from other people. And for my patients that do strip procedures, they do have some discomfort, and I'm able to eliminate it literally in 1 second, day one. So I'm glad you're doing well. Thank you for that little update of where we are, especially in comparison to somewhere else, so people get a sense of it. Because I think there's a lot of fear when someone comes in and does a transplant when they've had it done elsewhere that it's going to be very similar. Right. And you're not being paid for this, so this testimonial, so you at least get a sense that this is very different. Thank you.
Welcome.